Hello, this is Dr. Tom Groover of Boulder Chiropractic Clinic. I'd like to talk to you about strength and equilibrium training. I had a patient come to the office this week who had poor hip and leg strength and was complaining that her equilibrium was poor. She was worried about stumbling and falling. She had been through equilibrium training and didn't seem to find any results and had quit. And so I examined her to find out why she had poor equilibrium and poor hip and leg strength. And what I found was that her low back was misaligned. It had subluxations. And a subluxation is a misalignment of a joint less than a dislocation. And so I adjusted her low back and then retested her hip muscle strengths, and they were fully firing. The hip muscles were just really strong. And I said, based on this, your weakness is primarily coming from low back subluxation, and that as long as those subluxations are present, your exercise training is going to be limited. And she asked me how this all works, and I said, well, what happens is that your muscles are controlled by nerves that come from your brain and also reflexes coming from your spinal cord, and what you need to have is a clear pathway from the brain out through the lumbar spine, the low back, down the peripheral nerves and into the muscles and joints. And if you have that clear pathway, you will have what's called neuromuscular control. And if that pathway is interrupted, you will have a breakdown or a loss of neuromuscular control. And so what I did was I removed the impairment to nerve function that was occurring at the lumbar, the low back nerve root, because those nerve roots are sensitive to subluxation. And when the joints, the vertebral joints there, misalign like that, they impair the lumbar nerve roots. So when I saw that, I knew that if I adjust this, then the nerve roots will function properly, peripheral nerves will function properly, and therefore the muscle contraction can occur when desired at will, and can turn off at will, or after the contraction has completed, and the coordination will be good, and the sequence of the firing of the muscles will be good. So you will have neuromuscular control. So now she asked me if this would have anything to do with helping her with her equilibrium, and I said, yes, nice that you asked. You have two types of nerves that run to your muscles and joints. One of them is the motor neuron, which is what we just talked about, but also you have the sensory neuron. So the sensory neuron goes down and is responsible for something called proprioception, which is basically the sense of where your body is in space, your limbs are in space, the limbs are in relation to each other, the bones in relation to other bones within the joint, the pressure in the joint, the tension on the ligaments, tendons, and muscles pertaining to the joint. So if your proprioceptors are working well, that is what's required for that is that your pathway from your brain down through your nerve roots is clear, and that your peripheral nerves are clear. So I said, as long as we maintain your low back, you'll be able to train yourself successfully for equilibrium and train your lower body for strength. And so she asked me another thing about maintaining this alignment of her low back, and I noted to her that the specific nature of her low back misalignment is such that the vertebra want to get pushed backward in her low back. And when they do, they're subluxated, and then you get the impaired nerve root function. So I suggested that she maintain the adjustments, so she come in for follow-up frequently enough so we can verify that these adjustments are holding, and when they're not, we can restore them as quickly as possible in order to get this low back stable so it doesn't misalign. But to help do that, she needs to strengthen her low back, and specifically strengthen both in terms of muscle strength and habit of movement for her to maintain the arch in her low back, so that when she stands and sits and bends forward, that she maintains that arch, and particularly when she bends forward and lifts. And so I hope this information is really helpful for you, and if you have further questions or you'd like me to speak further about this or other subjects, please let me know. Thank you.